Hi there, it's Dr. Tansavatdi. It is about 1:30 on Tuesday, and we are trying to do our live broadcast on a regular basis now going forward. I'll be trying to do this at 11:30 every Tuesday going forward. Today's topic is going to be on facelift surgery, and I know there's a lot of fear around facelift surgery. I deal that in my practice all the time. I have patients who regularly have some concerns about the surgery and are hesitant to go forward with that surgery. And I think there are a lot of reasons why there are some fears around the surgery. I actually saw one patient today, and she is starting to come around. And I think the biggest thing is that surgery, even on the body, is a concern because it's physically you are having scars, possible scars on the body, and so much more on the face. This is a visible portion that everybody gets to see, and the concern is that, hey, the outcome is going to be so visible. If it doesn't go just as planned, everybody's going to see that you made that bad decision to have that surgery. So today I want to go over some of the questions about facelift surgery and some of the most common questions that cause fear about this surgery. So I guess the most important thing is there's so many terminologies out there. Everybody likes to come in and ask me, what is a mini facelift? What is a traditional facelift? What's a full facelift? What's a full, what's a lower facelift? And all these different terms out there. There's also the laser neck lift. There's also non-invasive facelifts. And then there's also the lifestyle lift. I think that's a very common question that people ask me about the lifestyle lift. How is that different? So I'm going to backtrack a little bit and go and talk about what's the least invasive facelift to the most invasive facelift, I should say. And a mini facelift, when you hear that term, it really means that you are doing something minimal, right? When it says mini, that means it's minimal work. The incisions are smaller. There's less of the skin raised to elevate and tighten the muscles underneath. Are the muscles being tightened? Yes, they are, but there's less work on them. So the spectrum is the less work that's done, you expect, the less time it's going to last. And so a lot of people want a little bit of work, a little bit of downtime, and a long result. Well, you can't skimp to get the result you want. A traditional facelift, and there's different techniques for that, the more dissection you have, the more swelling you're going to have after surgery, but the longer that result's going to last. And for certain that it is going to last, because even with some of the traditional facelift techniques out there, there is about a 20% rate of tuck-up, meaning that it still has to be revised after that surgery, that the result wasn't complete. So I think that people need to do their homework and really need to understand at what point can you have a mini facelift and what point do you have to have a traditional facelift. When you're younger, a mini facelift can get you the result you want, and actually can last a good deal of time. But as you get older, the skin, everything starts to become lax, and you really need to have more work done in order to get the result that you're looking for. So that being said, I traditionally do a facelift that starts from the incision, starts from right around the hairline, comes up a little bit here, and this is really well hidden, fades into the hairline really easily, comes right around the ear, and then goes behind. I don't do much work behind the ear. A lot of the work is actually lifting up instead of lifting back. And the traditional techniques in the past have been lifting back. And when we do that, everything starts to come back here, right in the neck. If somebody's had a facelift before and you start seeing that laxity right there, you know that it was done the traditional way, where it was pulled in a back technique behind the ear. and then that's when you're going to have this comeback in the neck. And people will come back to me and come to me from other surgeons and say, well, why did it fail right here? Well, that's one of the reasons why. So now I'm going to talk about, besides those options, besides mini facelift, a traditional facelift, there's also non-surgical facelifts. And there are good candidates for non-surgical facelifts. It's typically a younger patient with good skin quality. When you start getting more laxity in the skin, then you do need to go down the traditional facelift technique. And it really is an investment. You got to invest. It's just the same thing when it comes to your body. If you're investing in the right surgeon, the right surgical technique, you are going to get the result that lasts you. And then that money that sounds like it's a lot up front will last you many, many, many years. So what can you expect after surgery? The results should last 10 to 15 years. A good facelift should last that long. But we continue to age, so the things that need to be done after surgery are good skincare to keep that up. After surgery, you should see about 2 weeks before all the swelling and bruising is gone. And I usually tell my patients, wait to do any major events where you're going to be outside, putting on makeup in front of people. You want to wait at least 6. So plan the surgery ahead of time. You really need to plan this. And if you're looking to get a facelift done in the next few months, come in for a consultation now and really plan that out. Another question I just got was, why do people fear facelift surgery? So I think that's a typical question I get. Facelift surgery is very scary for a lot of people because you are making incisions right in front of the ear and it's visible for a short period of time, and people just don't want anybody knowing about their business. Why? Or actually having friends know that they were the stigmas that I'm vain to go get facelift surgery. And really in the end, it's all about how you feel. And you want to feel on the inside as youthful as you look on the outside, and there's nothing wrong with that. I think those were the major questions I wanted to address today. I'm going to leave with just a couple pictures of some facelift surgeries that I've done, and please find me on my website, www.facesbydrt.com, and you can also follow us on Facebook, Twitter, LinkedIn, Instagram, that's right, Instagram, and my sign is at facesbydrt. On Periscope, it's at Kristina Tansavatdi. I know that's a long last name to spell. And follow us also from our website. We have a newsletter that we put out on a monthly basis, and go on there and sign up for our newsletter. So without further ado, I'm going to show you some pictures and before and after photos of the face and lower face and neck, lower face and neck, and front face photo, neck, and network there. All right? Okay. Follow us on our website and our social media platforms. Oh, and again, please leave some questions. We want to know what people are interested in learning about. I'm happy to do this every Tuesday, and so post on our Facebook, our Twitter or Instagram with your questions or your topics that you want me to talk about, and I'll bring that up on the next week. I'll see you then. Bye.